welcome to Dr. Vibes. Today we shall study all the steps that you should do before performing any medical procedure. These are the following. But before, please make sure to subscribe the channel.
During any procedure, you have to first introduce yourself. In corporate hospital, you are given an apron, and on the apron your name is written over there. You explain the procedure to the patient as briefly as possible and take his consent if the patient is in that state. And then for every procedure, you have to maintain asepsis as much as possible, even though you will be working in general ward or in ITU. Maintain asepsis because that is very important. Always have a sterile tray ready. All the times it is not possible, but have a sterile tray ready. Keep your equipment over there. If you have an assistant, a co-intern with you, then it is better because he or she will be providing you the instruments in a sterile way. You wash your hands, or you know the steps of washing your hands.
Do you have any idea regarding the steps of hand washing?
Because in pediatrics, in neonatology, you know. So first of all, there are a few steps that you have to follow. You have to, you practice with me. You have to follow. First is rubbing your hands over your palms.
Take some soap.
Take some soap.
And then you start rubbing.
Start rubbing your hands, and then you go for the tips of the hands, tips of the fingers, go for the nails. Then you go to the wet spaces. So you go for the rubbing of the wet spaces. Then you go for the thumb. Go for the thumb, and after that you have to wash up to your wrists, and usually you will have an elbow operated tap over there. So you will wash your hands up to the elbow, and then with the elbow you will lock the tap, and you will keep your hands like this way so that the water draws downwards. Okay? So maintaining
Steps of hand washing has to be known by each of you. The steps are frequently asked, and hand washing is also mandatory for each and every procedure that you will be doing.
There are a total of 12 steps of hand washing given by the World Health Organization, and they're numbered from 0 to 11. The entire procedure is 40 to 60 seconds. First, wash your hands with water. Secondly, apply enough soap to cover all the hand surfaces. Now see from the second step. Second step is palm to palm. Third step is palm to the dorsum of your hand. First right and then left. Fourth is interlacing your fingers. Fifth is rubbing the back of your fingers to opposing palms. Sixth is rotational movement of the thumb. Seventh is again rotational movement, but then with the clasped fingers and over to the palm. In the 8th step, you will rinse your hands with water. 9th step, you will dry it thoroughly with a towel. In the 10th step, use a towel to turn off the faucet. Now if it is an elbow operated tap, then you can also use the elbow to close the tap. And the 11th step, you will dry your hands and your hands are safe. Sometimes in surgical procedures, we have to wash our hands till the elbow. So make sure of that.
Okay?
after that, go to the patient, and if you're providing gloves, before donning of the gloves, you should know that it will be provided to you because the outer surface is unsterile. I am showing it for the demonstration purpose.
The procedure that we follow is, if I am the assistant, I will be taking the gloves, I will be opening the gloves, and I will be dropping the gloves in the sterile tray. The inside part, this part is sterile. Okay, so she can touch it with her hands, right? And after that, she will be donning the gloves.
When you are given the sterile tray, you will be given in this position. So the glove will be so the gloves will be put right here, like this. You will open it, and then there is it is written over the paper which one is right, which one is left. So you will first take the gloves, and first what you have to do is you have to manipulate your thumb first. After you put your thumb inside the gloves, then you manipulate the other fingers, and then this part of the gloves that should be on the outer side only touch this part, goes up to this so that you can draw up to here. So that up to here the gloves is sterile like that. So first when you first wear the on the dominant hand, then just like this, first you insert the arm. Okay. After that you will manipulate. Once you wear the gloves in your dominant hand, then it becomes easy because this hand is sterile. You can touch the gloves anywhere. But wearing the gloves on the first hand, you have to first put your thumb, then wear along the other fingers. Okay? Then sometimes in a surgical OT or in an orthopedic OT, you will have to wear double gloves. You will know that. So this is the gloves, Donnie.